Okay, go ahead.
Good morning. Jonathan Friedberg, Director of Wilmot Cancer Institute. I'm here on this lovely day at Highland Bowl with my dog Leah, my other dog Kira, and I'll let Ralph introduce himself.
Hi, I'm Ralph Olney. I am a cancer survivor and I've been treated at the Wilmot Cancer Institute since July of 2011. So I'm here to talk a little bit about my story and the wonderful care that I've gotten from the Cancer Institute.
We thought that during this virtual walk, everybody's walking all over, but we wanted to come back to the Highland Bowl and do it here. And I have to say that I'll give credit to Richard DiMarzo, who started this event, because we always put him in charge of the weather. And somehow, wherever Richard is right now, he came up with a beautiful day for us.
All right.
How many years have you done this walk?
So this is the fourth year that I've actually been able to walk. To be quite honest, the first 3 years, although we had donated to the cause, I was not physically able to do the walk. So this will be my fourth year.
It's and I think your team keeps getting bigger and bigger, right?
Yeah, we're very blessed. Our team this year, we have donations from people in 21 different states. Actually, we had a donation from friends in China, one from Australia, and I'm working on one from the UK. So we've had over 200 people that have vowed to participate in the walk this year.
That's fantastic. In fact, I think this virtual walk, not the same feeling, of course, but it does expand participation at some level because people from all over. I saw in the video that we made, there's somebody in Cambodia who's walking for the cause as well.
Yeah, we've had tremendous participation. Our team so far this year have raised just a hair over $17,000. So we're really glad because we know that money will go into some of the research that you guys are doing that will help people like myself, that have gone through cancer treatment.
That's right. So the proceeds from the walk go to both our cancer survivorship program and our cancer research programs. Cancer survivorship, I don't have to tell you, is a very important issue. And Wilmot is one of the leading cancer survivorship programs, not just regionally, but nationally. Both clinical program as well as research in that area. And then the research, of course, is my passion. That's really what differentiates us from any other cancer center in the region, and it allows us to do clinical trials for patients, new therapies, and hopefully discover cures so people don't have to go through what you went through.
Yeah, as Dr. Friedberg mentioned, I am still undergoing treatment after 9 years. I've had 2 stem cell transplants. The first one back in November of 2011, I was given a 50% chance of surviving till the end of the year. I was put into remission. 2 years later, I fell out of remission. And in June of 2014, I had a second transplant, and I only had a 17% chance of surviving. As Dr. Friedberg said, it's because of the learnings from the research work that was done at the Cancer Institute. Some of the new treatments could be used, and that's what saved my life. So I'm eternally grateful to the Cancer Institute for the experts that they have there and the knowledge that they have to treat patients like myself.
People often ask me, are things really changing or are things really getting better with cancer? And I think that what you described is a little bit of an example of that the disease that you unfortunately have for almost 40 years was treated really with one cocktail of chemotherapy. And over the last 2 or 3 years, a number of new drugs now have been developed using different mechanisms and targeting specific proteins and mutations that may occur in an individual patient. And we're getting to the point where we can come up with a much more precision cocktail for any given patient. And that, is really, I think, the beginnings of maximizing cure rates and also minimizing side effects. So it's an incredibly exciting time.
Yeah, so as a patient, what Dr. Friedberg's describing is I've had many side effects as a result of the treatment. And I know over the 9 years I've been treated, because of the some of the donations we've made and some of the participation that we've had on some of the research projects, that they're targeting the treatment so the side effects will be minimized. And our team only's goal is to try to provide whatever funding we can, whatever support they need, so that patients won't have to go through some of the significant side effects like I continue to go through.
And that's really, I think, a goal of Wilmot. We don't want patients to just survive, we want them to thrive. And side effects are sometimes a necessary evil of cancer treatment. But for people out there who are patients, or for people who know patients, please know that we're working on that, and things aren't as bad as they were even 5 or 8 years ago for many types of cancer as far as side effects go.
Yeah, I think the other thing that has happened over the years is our oncology team. There's a number of experts at the University of Rochester Medical Center that are specifically trained in dealing with cancer patients. So if there is anything that comes up, there is someone there that you can count on that understands your condition, and they're there to help. So it's very reassuring, and it's almost like a family atmosphere in the sense when we're there. We know the oncology team, the nurses, the doctors. So it's just a good place to go to be treated, in my opinion.
I think in many ways it's a microcosm of Rochester. Rochester is a friendly place. We take care of each other. And, our faculty and staff at Wilmot are exactly like that. One of the other advantages of Wilmot that I think you saw was that we're part of a large academic medical center as well. And if people do get side effects that may affect their heart or their lungs or get infections, we have specialists that we can tap into from across the entire medical center. And that's really important for many patients who are having some of these specific problems.
Yeah, so as far as trying to help the Cancer Institute,
Watch your step here, guys.
Yeah, if it wasn't for them, be careful. Yeah,
It's easier to
If it wasn't for the Cancer Institute, honestly, I would not be alive today. So our team over the years has been able to raise money that's gone specifically towards leukemia and lymphoma research. And they've been able to use that money to leverage that, with additional grants to do some of the research that's necessary to make improvements in treatment plans. So we have a very big commitment to continue to do that, to support the great work that you're doing at the Institute.
We can't do that work without support from the community. We've been very successful at Wilmot at getting federal grants. For example, this year we have almost $13 million in direct costs coming from the National Cancer Institute. That's an almost doubling over the last 6 or 7 years, given recruitments and our efforts at garnering that type of support. And if you look at our total budget from the NIH, it's close to $30 million a year we have for cancer-related activities. But even with all of that work, in order to do pilot studies and critical new types of research, we really rely on community support. And sometimes modest amounts of money can go an incredibly long way. And we have numerous stories where maybe $20,000 or $25,000, not saying that's modest, but can turn into a grant for $1.5 million. And that's good for Rochester. It brings money into our area. It allows us to employ people and foster the research engine.
Yeah, and it's very rewarding when you can give back, and you know that you're helping others, and you can see either your time or the money that's raised, being put to good use. So, I really want to thank you, Dr. Friedberg, and the Cancer Institute for what you've not only done for me, but we've talked to many other patients, that have gone there, have been treated, and are leading a full life as a result of the treatment. So, a lot of people out there that are very grateful for what you do.
You're very kind. You're bringing up a point that, one of our newer initiatives that we're focused on is ensuring that patients throughout our broad catchment area get the cancer care that they need. And there are a lot of groups within our catchment area, which is 27 counties, going all the way east to Utica, south to the Pennsylvania border. There are a lot of people in that area where there may be a lot of unique challenges. Rural patients who live in rural communities may have trouble, even accessing care. Even patients in parts of Rochester struggle with transportation and financial concerns. And we've set up an entire office to deal with these challenges, to help overcome disparities in care, and to do research to try to ensure that ultimately, the care will be even across the entire system. And I think that we can leverage these findings nationally, because it's not just unique to our catchment area. Caring for rural patients can be a challenge. One of our solutions has been that we've opened 13 centers scattered around our region, so people don't have to drive so far and still have access to Wilmot care, entry points to and often getting radiation infusions close to the home.
So Dr. Friedberg, I'm just curious, in your opinion, if there are other cancer survivors like me that want to help in some way. What recommendations might you have for people who want to get involved?
Yeah, well, first of all, we'll always take the help because we really do need it. But I think really one of the best investments that people can make, and I like that word, investment, is in our research programs. As I said before, that's not only what differentiates us, but if you want to make sure long-term that you don't need to go to any other city, that no matter what kind of cancer you have, we can take care of you right here with cutting-edge treatment, we need an active research program. It allows us to recruit the best physicians, the best team members, and we all mobilize around these clinical trials and new treatments. In order to really demonstrate that we're in that league, we're in the process of preparing a grant that we hope will lead to what's called NCI designation. And what that means is that the National Cancer Institute designates centers based upon the depth and breadth of their research, their clinical trials, and their attention to their catchment areas. And we are, as I said, in the process of preparing that application. It's going to go in sometime next year. It's going to be over 1,000 pages long. It's a lot of work, and we have a whole team working on that. But I'm confident that we're going to be recognized ultimately with that, and that will really demonstrate nationally and to the world that we're one of the top cancer centers in the United States. Yeah. And the investments that you and others are making right now are going into that effort to make sure that we have the depth of research necessary to meet those criteria.
That's fantastic. I can tell you that Stephanie and I with the Warrior Work Committee, they're all very committed to doing exactly what you said. There's about 20 of us that have worked together to organize the virtual walk this year. The fundraising's going well, but the amount of excitement and participation in this very odd time, COVID has really turned things upside down, is remarkable. But it's because of all the stories, the success stories that they hear about patients like myself, that have gone through and been either cured or put into remission because of the work that you've done. A lot of the research work that comes to fruition through clinical trials. Just outstanding work. So we're committed to do whatever you need. So thank you.
Well, we're really blessed. And I will say that the community support course, financially is important, but it's also a mechanism, to motivate us. There's nothing more motivating than knowing that people in your own community have such trust in you that they're investing their precious resources toward what you're doing. And I know that our scientists and researchers feel that way. And when we hear that we're giving people a pilot grant that was based on community fundraising, I think that causes our scientists to dig extra deep and work extra hard. So it pays off in many, many ways.
Yeah. And Dr. Friedberg, you're still, I don't know what the right word, you're doing both the trials, right, and you call them patients, I think, still,
Yeah,
right?
yeah.
And so you've got, you understand how the translation from research into patient care happens, which is a little unique, and I think that's why, the team is so successful in their research work. It's all focused on the patient and making sure that patients have just the best care. And I'm a recipient of that. And I wouldn't be here today if it wasn't for that. So.
I obviously spend a fair amount of my time now doing administrative work, but I do spend one full day in the clinic still every week, and I would say that most weeks that's my favorite day of the week. I really still enjoy that work, and it's motivating and very grounding to be there. I also do run a research program, and I chair a group that does national clinical trials in lymphoma. And I also have a grant here to do a trial that we're running locally here, but it's open at 8 centers across the United States. And those trials are, I think, going to be very exciting to see those results. There's nothing like doing a trial, seeing what the result is, and then seeing that it's positive and knowing that you've really helped people.
Okay.
So we're at about 15 minutes, I think. I want to give just a quick shout out to some people who've been following along with us. Heather, Vincent, Lauren, Barbara, Ann Lynn, Sarah, John, Nikki, thank you all for your really kind comments and for being with us virtually this morning. Ralph and Dr. Friedberg, I don't know if there's any kind of final parting words you want to offer before we close it out, or?
I'll say, yeah, and then you can close it out. Is that
All
okay?
right.
All right.
Sounds good.
So just, from a patient's perspective, when I was first diagnosed, I had some choices to make about where I should go. Without question, going to the Wilmot Cancer Institute was the place that I needed to be. And to this day, the team that started treating me is still in place, and they're still there, and they're still taking excellent care of me. And this is a story that I've heard from many others. So, if you have the unfortunate circumstance of getting cancer in some way, you really should consider the Cancer Institute with the research and development work they're doing, and then bringing that into patient care. It's the best place to be. So God bless all of you. Thank you for tuning in today. I appreciate that.
I want to thank everyone for their support, and Leah and I really encourage you to get outside today. Do your part of the walk, whether it's a walk, a run, a 5K, a 10K. You can choose all those options. And as I look here at the Highland Bowl, I'm envisioning 2,000 people here next year from now, celebrating together. Thanks so much for your support.